Hello, everyone. Welcome to our YouTube channel. Today, we got something really important to share with you. We're going to talk about the top 6 foods that could be making your arthritis worse. Plus, we're diving deep to reveal what really causes the pain and swelling in your joints. And don't worry, we've got an awesome solution to help you tackle it. First off, let's understand what arthritis is all about. It's a health condition that causes your joints to swell up, get stiff, and hurt, making it harder for you to move around like you used to. There are over 100 types of arthritis out there, but the two big ones are osteoarthritis and rheumatoid arthritis. Osteoarthritis is the kind you hear about most. It happens when the cushiony cartilage in your joints wears down over time, either from just getting older or from an injury. This is the wear and tear type. Rheumatoid arthritis is a bit different. It's when your body's immune system gets confused and starts attacking your joints, causing swelling and pain not just in your joints, but it can mess with other parts of your body too. There are other kinds too, like psoriatic arthritis. This one is linked to psoriasis, which is when you get red skin covered with shiny scales. Then there's gout, which really hurts. It's when crystal-like stuff builds up in your joints, especially your big toe, causing a lot of pain. And don't forget about fibromyalgia. This one spreads muscle pain and tenderness all over your body, making you feel super tired and sore, especially around your joints. Even though all these types of arthritis seem a bit different, they have one big thing in common: inflammation. Inflammation is a key player in all kinds of arthritis, leading to pain and stiffness. So, stick with us as we start by revealing the first harmful food for your joints. Then we'll uncover the real reason behind the inflammation and pain arthritis causes. Let's dive in. Number 7. Oils and trans fats. Vegetable oils, also known as refined seed oils, play a big role in making arthritis worse and increasing inflammation in the body. These oils include common kitchen staples like corn oil, sunflower oil, safflower oil, and soybean oil. You'll find them not only in many homes and restaurants, but also in a lot of the foods we eat every day, especially processed or packaged foods. Think about the snacks and fast foods many of us enjoy, like potato chips, hot dogs, white bread, fried chicken, French fries, and salty snacks. They all usually contain vegetable oils. Avoiding these oils can be really hard because they're in so many foods. But why are these oils a problem? The big issue with them is that they're full of omega-6 fatty acids. These fats don't do well when they're exposed to heat and light. They start to break down a process called oxidation. During oxidation, the oils react with chemicals and become damaged or rancid. When we eat these damaged oils, they can cause inflammation not just in our joints, where they can make arthritis pain worse, but also in our gut and blood vessels. To make things even more challenging, there's something else in our foods that's even more harmful: artificial trans fats. You might see these on food labels described as partially hydrogenated oils. These fats are particularly bad for our health and can further increase inflammation and pain for people with arthritis. Vegetable shortening, which is commonly found in baked treats, microwave popcorn, margarines, fried fast food, and non-dairy creamers added to coffee, is a major source of unhealthy trans fats. To fight off inflammation and ensure healthier joints, it's recommended to switch these out for good fats. Opt for healthier oils and fats like those from avocados, macadamia nuts, coconuts, grass-fed cows, butter, and olives, extra virgin olive oil. Now, let's take a closer look at what really causes joint pain. You might think it's all about inflammation, but the situation is a bit more complex. The actual troublemaker is something called fibrin, which builds up around the joints, causing ongoing inflammation and discomfort. So, what exactly is fibrin? It's a kind of protein that our bodies use for healing wounds. It works by forming a strong network, similar to a net, that creates clots, scabs, and scars to help wounds heal. Here's how fibrin gets to work. Whenever you get a bump, a cut, or even when your body reacts to a sudden temperature change, your body reacts. Firstly, it sends white blood cells to the injured area to fight off any potential infection, leading to inflammation and swelling. Secondly, fibrin jumps in, making a tough protective web over the injury to start the healing process. This web catches important components, like platelets and red blood cells needed for clotting and healing. Normally, after the injury heals, fibrin dissolves and inflammation goes down. But in cases of arthritis, fibrin doesn't stop building up. It keeps collecting in the blood vessels and tissues around the joints. Too much fibrin can become stiff and form scar tissue, cutting down blood flow and oxygen, slowing down healing, and leading to lasting stiffness and pain. That's why typical pain relief methods often become less effective. They're not tackling fibrin, the root of the problem. And fibrin doesn't just cause joint issues. Its excess in your bloodstream can affect your overall health by blocking red blood cells from getting where they need to go, making your heart work harder and increasing your risk of heart disease and strokes. Before we dive into how you can reduce fibrin levels and improve your health, let's discuss more foods that you should avoid as they can contribute to the problem. Remember, knowing what harms can help you make better choices for your health. If you find this advice useful, don't forget to like, share, subscribe, and hit the notification bell so you won't miss any updates. Now, let's talk about the number 6 topic, which focuses on how soda and sugar can affect arthritis. Soda drinks are particularly bad for people with osteoarthritis because they have a lot of refined sugar. Drinking soda causes your blood sugar and insulin levels to shoot up quickly. This increase can lead to more inflammation in your body. Not just soda, but any drinks that are sweetened with high fructose corn syrup pack a lot of calories that don't offer any nutritional value. These are often called empty calories. Consuming these beverages can make you gain weight, which is not good because extra weight puts more stress on your joints and can make arthritis symptoms worse. One good way to fight against inflammation is to stop drinking sugary drinks and choose healthier options instead. You can drink unsweetened tea or plain water. Just by doing this, you can cut down on the amount of refined sugars you take in and give your body a much healthier option to hydrate with. This simple change can make a big difference in managing your arthritis. Number 5. Refined carbohydrates. Have you noticed that sometimes after you eat a lot of pizza, bagels, cookies, donuts, or pasta, your joints start hurting more? That's because these foods have something called refined carbohydrates. When you eat them, they quickly turn into sugar in your body. This makes your insulin levels go up really fast. When this happens, it's similar to what happens when you drink soda. It causes inflammation all over your body. Imagine it like a wave of discomfort spreading inside you, making the pain from arthritis or any joint discomfort worse. What can you do about it? A good start is choosing healthier options. Instead of white bread or regular pasta, you could try whole grain bread or sweet potatoes. These options don't turn into sugar as fast, so they're better for keeping insulin levels steadier. Also, think about whether gluten might be making things worse for you. Glute is found in many foods, and for some people it can kickstart inflammation. If that sounds like it could be you, trying to avoid gluten might help with reducing that swelling and pain you feel in your joints. So by making these changes, you're not just eating healthier, but you're also taking steps to feel better and reduce the discomfort that comes from inflammation. Number 4. Glute. Now we're going to talk about glute and why it's important, especially for people who have trouble with it. Some folks have celiac disease or are sensitive to glute, which is a type of protein found in wheat, barley, and rye. When they eat foods with glute, their body's defense system reacts in a way that might lead to joint pain and other uncomfortable symptoms. There was this research shown in the Oxford Journal of Rheumatology where about 41% of people with a condition called rheumatoid arthritis felt better after they stopped eating glute. That's almost half of the people in the study. If you think gluten might be causing problems for you too, here's what you can try. Stop eating any food that has gluten in it for 2 weeks. This means no bread, pasta, or anything else that comes from wheat, barley, or rye. While you're doing this gluten-free test, pay attention to how your joints feel. Do they hurt less? Do you feel better overall? After those 2 weeks, start eating gluten foods again, but do it slowly. Watch carefully how your body reacts. Does the joint pain come back? Do you feel worse? Watching how you feel during these tests can really help you figure out if glute is something that makes your joint pain worse. Remember, glute is in a lot of foods, so you'll need to check labels and be mindful about what you're eating while you're testing this out. Number 3. Char-broiled and blackened foods. Next, we're going to talk about 2 types of foods that are often cooked at high temperatures: char-broiled and blackened foods. If you're dealing with arthritis, it's a good idea to stay away from cooking methods that involve really high heat. This includes broiling, cooking food with high heat from above, frying in a lot of oil, and grilling, cooking food over direct heat, usually on a grill. Why? Well, when foods are cooked at high temperatures like this, they create something called advanced glycation end products, or AGs for short. These AGs can make inflammation worse in your body, leading to more joint pain if you have arthritis. So, to help keep inflammation and joint pain in check, it's best to avoid eating a lot of foods that are grilled, like grilled meats, or fried, like French fries. By doing this, you're cutting down on the AGs you consume, which can help reduce inflammation. Number 2. Nightshade vegetables. Let's talk about a group of vegetables that might surprise you: nightshade vegetables. These include common foods like tomatoes, eggplant, potatoes, and peppers. Now you might wonder, what's so special about these vegetables? Well, if you're dealing with joint problems, such as osteoarthritis, rheumatoid arthritis, or gout, paying attention to these veggies can make a big difference. Nightshade vegetables contain substances called alkaloids. While these alkaloids are natural components of the plants, they can have some tricky effects on our bodies, especially for those with certain joint conditions. Here's what happens. The alkaloids might promote the buildup of calcium deposits in areas where we really don't want them, like our tendons, ligaments, cartilage, and joints. Why is this a problem? Because these unwanted calcium deposits can lead to inflammation and pain in the affected areas. When our joints or the surrounding tissues get inflamed, it can cause discomfort and make moving around harder. So, for people struggling with joint pain, it can be helpful to try cutting out nightshade vegetables from their diet to see if it makes a difference. By doing so, they might help reduce the possibility of calcium buildup and, consequently, ease the pain and inflammation in their joints. Number 1. Alcohol and tobacco. Alcohol can exacerbate inflammation in the body. For individuals with arthritis, this added inflammation can aggravate joint pain and potentially lead to a worsening of symptoms. Many people with arthritis take medications to manage their condition. Alcohol can interact with these medications, decreasing their effectiveness or even leading to dangerous side effects. This is particularly concerning with non-steroidal anti-inflammatory drugs and methotrexate. Excessive alcohol consumption can impair the body's ability to absorb essential nutrients. This is a concern for arthritis patients, as deficiencies in vitamins and minerals like vitamin D and calcium can worsen joint health. Maintaining a healthy weight is crucial for reducing stress on joints, especially for those with osteoarthritis. Alcohol is high in empty calories, contributing to weight gain and increased joint pressure. Smoking tobacco not only increases the risk of developing rheumatoid arthritis, but can also exacerbate the symptoms in people who already have arthritis. Nicotine in tobacco is a stimulant that can increase inflammation throughout the body. Smoking impairs blood circulation, reducing the amount of oxygen and nutrients that reach the joints. This can delay healing from joint injuries and may accelerate the degenerative process in diseases like osteoarthritis. Similar to alcohol, tobacco use can interfere with the effectiveness of arthritis medications. Smokers may find that their medication doesn't work as well, requiring higher doses for the same effect, which could increase the risk of side effects. Smoking is linked to lower bone density and an increased risk of fractures. For individuals with arthritis, weakened bones can exacerbate joint pain and contribute to overall discomfort. Avoiding alcohol and tobacco can significantly benefit individuals with arthritis by reducing inflammation, avoiding negative interactions with medications, and promoting healthier body weight and bone strength. Through mindful lifestyle changes and seeking appropriate support, managing arthritis symptoms and enhancing quality of life is achievable. Today we're diving into how to tackle arthritis from its root cause, and it all circles back to something called proteolytic enzymes. These enzymes are super important if you're looking to live without that nagging pain because they have some serious anti-inflammatory powers. So, what are proteolytic enzymes? They're a kind of enzyme that takes proteins and breaks them down into smaller pieces that your body can easily handle and use. A big job these enzymes do is to attack excess fibrin. That's stuff that can build up in your blood and muscles, making things stiff and painful. When these enzymes get to work, they help clear out the fibrin and any scar tissue, improving blood flow that's rich in oxygen and nutrients to your body's tissues. This is key because it helps get rid of waste that can lead to more pain and swelling. Our bodies do make these enzymes, mainly in the pancreas, but after we hit 27, we don't produce as much. That means we need to get them from what we eat or from supplements. For a natural boost, pineapple and papaya are your go-to fruits. They're packed with bromelain and papain, enzymes that have been shown to ease pain, reduce swelling, and make joints less stiff in folks with arthritis. I think we got a cool recipe for a pineapple joint elixir you might want to try. But that's not all. You can also find these helpful enzymes in foods like kiwi, figs, ginger, asparagus, and fermented goodies like sauerkraut, yogurt, kefir, and miso. Besides fighting inflammation and pain, proteolytic enzymes can also lessen muscle soreness, speed up healing, help regulate blood pressure, give your immune system a boost, and fight off viruses. In summary, getting more pineapple and papaya in your diet could be a game changer if you're dealing with arthritis. But it's good to remember that just eating these foods might not be enough to significantly up your enzyme levels and get the relief you're looking for. Thanks for watching. If this info was helpful, please share it with others. Keep an eye out for more videos coming soon. Till next time, take care and goodbye.